Well, today we'll talk about this complex mandible fractures treatment. Um, I have no conflicts of interest to declare, and I work in 3 hospitals. One of them is Hospital del Trabajador Workers Hospital, that is one of the AO CMF centers around the world. Here in my city, Santiago de Chile. Santiago of Chile. Well, the objectives of this presentation is to know the clinical characteristics that make a mandibular fracture be considered as complex, and to know the guidelines of the treatment of the complex mandibular fractures. Well, the mandible is an important bone. Without considering the little bones of the ear, the mandible is the only mobile bone in the skull. It is a determinant of the function of the stomatic system, is determinant of the growth of the face, is determinant of the volume of the upper airway, and is composed by 6 different units: the condylar unit, the angular unit, the coronary unit, the body unit, the dental alveolar unit, and the unit of the chin. Each one of them may be involved in trauma. About the definition of complex mandible fractures, we can say that it corresponds to those fractures that has 2 fracture lines and 3 or more fragments in the same region. So we have basal triangle fractures, we have segmental fractures, we have comminuted fractures and defect fractures. Also, previously affected fractures and simple fractures in atrophic mandible are considered complex ones. So these are the kind of patients that we regularly consider as complex fractures. The comminuted one, for example, in this one, but also multiple fractures lying along the mandible that make different segments of the mandible and that involve the complete integrity of the mandible must be considered as complex fractures. Some epidemiologic data. This is a study in USA where they analyzed more than 13,000 cases, and they saw that about 27% of the cases affect the condylar unit of the mandible, followed by the area of the chin, then the body, and so on. This is my own data for the last of the last 10 years from 2015 and 2025 of patients that I operated in Hospital del Trabajador, and of 744 surgeries that I did as a first surgeon, 110 were mandibular fractures, and 85% of those fractures were complex ones, in which the car accidents were the main cause. And also, I had the condylar unit of the man almost the same as any fracture of the mandible. So is to restore the occlusion, to obtain a perfect reduction of the fracture, to give a stable fixation that allows a painless movement of the mandible, and to keep a good supply to the portion of the mandible that is involved in this fracture. And complex mandible fractures challenge us in different ways. It challenges in the process that we'll have to do. It challenges us in the fixation that we will choose to use in our patient. It will challenge us in the management of infection. It will challenge us also in the management of complications. There are more frequent than in simple fractures and sometimes harder to treat. And the challenges, the process challenges us because of the complexity of the anatomy of the face, where we have visceral, neural, vascular, muscular, so on structures of the face that we have to take care of them. And of course, there's a cosmetic consideration about the complexity of the approaches that we will use because of the sensitive that the cosmetics has in the territory where we work, that is the face. So There are several approaches designed to reach the different skeletal units of the mandible, and sometimes the the injury that the patient may present in soft tissues of the face may serve as as an approach. And in many occasions, in this kind of fractures, we will have to combine these different kinds of approaches. And also, sometimes we have to do some very big approaches to the mandible in order to obtain a good exposure that let us make a good reconstruction of this affected bone. About the fixation, I think that there are three main things that we have to worry about when we do the fixation of the mandible. One is the sequence of how we will do this fixation. The other one is the kind of fixation that we will choose in a certain case, and where we will put our plates and screws in this fracture mandible. Well, we should start by the simplification of the fractures. This means put in position the little pieces of bones or the big pieces of bones and fix it with little plates, mini plates, in order to arm this kind of puzzle of bone in the mandible. And it seems better to do this in a upper bottom way. So starting from the dental alveolar unit and to the inferior border of the mandible. And once we already have done that, we have to do the final stabilization with a stronger plate that will make the final support to this fracture bone. Like we did in this patient with a comminuted fracture of the left body of the mandible, where we put in position the little pieces of bones with mini plates, and we once we have already done that, we finally put the reconstruction plate that give us the support to the mandible. About the kind of fixation, the kind of fixation that we'll choose will mainly be determined by the biomechanics of the mandible, that it's also determined by by the action of the different muscles that participate in the mandibular motion. And these muscles will provoke forces in different directions in different areas of the muscle, making these different forces like tension forces, compression forces, and torsion forces in different areas of the mandible that will make a very complex thing to do or to take in consideration at the moment to choose our osteosynthesis material. So in functional, according in functional considerations or functional considerations about osteosynthesis, we have two ways to do it. One is the load bearing, where the osteosynthesis material supports the entire load, and the load sharing, in which the osteosynthesis material allows the normal forces of the mandible sharing the loads with the bone. About the location, this will be mainly in the pillars of the mandible. This is the posterior and inferior border of the mandible, and also some areas with more dense bones like the lateral oblique line.